Mental health is a critical aspect of overall well-being, yet it remains a significant challenge for many, particularly those in minority communities. In the United States, racial and ethnic minorities face a disproportionate burden of mental health issues, experiencing higher rates of mental illness and poorer access to care compared to their white counterparts. According to the American Psychiatric Association, only 1 in 3 Black adults and less than 1 in 5 Hispanic adults with mental illness receive treatment each year. These disparities are deeply concerning and reflect systemic inequities that permeate our society. The stigma surrounding mental health is often amplified in minority communities, preventing individuals from seeking the help they need. Cultural factors, such as language barriers and differing beliefs about mental illness, can further complicate access to care. The consequences of untreated mental illness are far-reaching, impacting not only individuals but also families and communities as a whole. Untreated mental health conditions can lead to academic difficulties, unemployment, substance abuse, and even involvement with the criminal justice system. Addressing mental health disparities is not only a matter of social justice, but also an economic imperative. By acknowledging the unique challenges faced by minority communities and working to dismantle systemic barriers, we can create a more equitable and just mental health care system that serves all Americans. This requires a multifaceted approach that addresses the social determinants of health, promotes culturally competent care, and empowers communities to take ownership of their mental well-being. To effectively address mental health disparities, it is crucial to understand the underlying causes that contribute to these inequities. One significant factor is the pervasive impact of historical and ongoing trauma experienced by minority communities. From slavery and segregation to present-day discrimination and violence, these experiences leave lasting scars that can manifest as mental health challenges. Socioeconomic factors also play a significant role in mental health disparities. Poverty, unemployment, and lack of access to quality education and healthcare disproportionately impact minority communities, creating chronic stress and limiting opportunities for upward mobility. These stressors can contribute to a higher risk of developing mental health conditions. Furthermore, implicit bias within the healthcare system can create barriers to care for minority individuals. Studies have shown that racial and ethnic minorities are less likely to receive appropriate mental health diagnoses and treatment, even when presenting with the same symptoms as their white counterparts. Addressing these disparities requires a comprehensive approach that tackles both individual and systemic factors. This includes addressing historical trauma, promoting economic empowerment, and dismantling systemic racism within the healthcare system. Improving access to mental health care for minority communities requires a multi-pronged approach that addresses both systemic and cultural barriers. One crucial step is to increase the diversity of mental health professionals. Having providers who understand the unique experiences and cultural backgrounds of their patients can help build trust and improve treatment outcomes. Culturally competent care is also essential. This means providing services that are sensitive to the cultural beliefs, values, and practices of diverse communities. Language access is another critical aspect of culturally competent care, as language barriers can be a significant obstacle to seeking and receiving treatment. Community-based mental health services can also play a vital role in reaching underserved populations. These programs often provide culturally tailored services in familiar settings, reducing stigma and increasing accessibility. Integrating mental health services into primary care settings can also improve access, as many individuals may feel more comfortable seeking help in a familiar healthcare environment. Finally, addressing the social determinants of health is crucial for improving mental well-being in minority communities. This includes addressing poverty, improving access to quality education and housing, and creating safe and supportive neighborhoods. Recovery from mental illness is possible, and there are numerous evidence-based treatments available to help individuals manage their conditions and live fulfilling lives. These include therapy, medication, and lifestyle changes such as exercise, stress reduction techniques, and social support. Community plays a vital role in supporting mental health recovery. Strong social connections, peer support groups, and faith-based organizations can provide a sense of belonging, reduce isolation, and offer encouragement and hope. Policy changes are also essential for creating a more equitable and just mental health care system. This includes expanding access to affordable healthcare, investing in community-based mental health services, and addressing the social determinants of health. By working together, we can create a society where mental health is valued, stigma is reduced, and all individuals have the opportunity to achieve optimal well-being.